There's no pin.
All right. Good morning, everyone. Thank you for joining us today for the Recovery Committee meeting. Just a reminder, if you're not presenting, if you could please mute so that we do not get feedback in the meeting, that would be great. It looks like we've got some callers who need to mute. All right, so we're going to go ahead. Let me review the agenda. As always, we will have Steve talk about our dashboards of data, a health officer update by Dr. Velasquez, some general response updates from Lindia, a communications update from Kelly, And today we wanted to provide you with an update related to our equity branch. We've mentioned that Spokane is very unique in that we're looking at equity through our response and the importance of that. Helene Dewey presented before, but she's not available today, so Heather Wallace is going to present on that. And then during the open discussion time, I want to go through kind of the phases of readiness planning. And if anyone has any additional topics to add, please let me know or put it in the chat to make sure we get them included. And again, callers 2, 3, 4, and 5, if you could please mute, that would help us keep the feedback down. So Steve.
All right, good morning, everybody. So new cases in the prior week, that is December 6th through 12th, were 2,606. There were 1,924 the prior week. That puts the daily average up to about 372, where there was 275 the week before. It should be noted that case counts are expected to include some of the Airway Heights Correction Center outbreak, not all of it. As we work through adjusting that, we will continue to knock those to their county of home origin. Nevertheless, it still is an increase that moves our 2-week total also up to 4,511. The prior 2 weeks was 4,327. Age groups affected, it's staying relatively the same, although I guess we have a new winner this week. 0 to 9, it was 4% of cases, 10 to 19, 9%, 20 to 29 was 19%, and 30 to 39 jumped up to 20%. Again, just staying 15% for 40s, 15% for 50s, and then dropping off from that. So staying within that working age adult group. Hospitalizations, we saw 50 new Spokane County residents hospitalized in the period of December 6th through 12th. There were 93 the prior week. Currently hospitalized in Spokane, there are 130 individuals. Again, 50 of those are Spokane County residents. 103 of those are Spokane County residents. For deaths, we had unfortunately 16 new deaths the prior week, 2 individuals in their 50s, an individual in their 60s, 7 in their 70s, 4 in their 80s, and 2 in their 90s. There were 18 new deaths the week before. We continue to see an increase in testing. Total tests for the week of November 29th through December 5th were 11,044. The average number of individuals tested daily is about 1,578. That is up significantly from 1,207. Our test positivity rate in the good news is going down slightly at 22.5%. There were 24.2% positive the prior week. Our healthcare system readiness, I adjusted these as requested. Number of staff beds, we have 1,097. Number of licensed beds, we have 1,501. Occupied census for staff beds is 77%, for licensed beds is 56%. Total COVID census for staff beds is 12%, and total COVID census for licensed beds is 9%. In addition, I added some other information about healthcare system readiness. None of the hospitals that report to us have reported critical staffing shortage yesterday or in the prior week. The on-hand supply remains about the same, although there is extended use or reuse conditions of Providence, and there are currently 19 surge or overflow beds in use. For case and contact metrics, last week, SRHT-affiliated staff investigated 1,206 of those cases. Reached within 24 hours was about 64%, which is a slight increase. Our care coordination branch continues to work with families and households. To date, they have seen 1,324 families or households. Currently, there are 258 cases open. They closed 63 last week. For service trends, we're looking at PPE and cleaning supplies, food, and medical needs. The isolation facility is at a fair census at the moment. The hotel facility census was at about 60% yesterday at 3:30 p.m. The Immaculate Heart Retreat census was at 44%. Our business technical advisors are working with businesses in the community. To date, they have done 4,156 consultations. Between December 7th and 13th, they did 313 and have completed 3,900 referrals at this point. Unfortunately, due to furloughs imposed by the state, the food security and child care statistics are not up to date at this time. For unemployment insurance claims, in the prior week, there were 1,859 new claims for unemployment insurance, which is up by about 100. The industries impacted most were food services and drinking places, specialty trade contractors, and accommodation, which is a new one for us. Finally, for protecting high-risk populations, currently there are 67 outbreaks in long-term care facilities. 34 of those are considered under active investigation, which means there's an increase of 2 facilities in the prior week. And that concludes my report. Are there any questions?
Any questions for Steve? Oh, Commissioner Q.
So Steve, I do have a quick question. So Airway Heights, you guys, that's not part of our count, but like what's happening at Geiger, our detention services is part of our count. Is that correct?
Sorry, I only heard the first part of that.
So you were talking about Airway Heights Correction is you're just trying to figure out the only Spokane County residents are part of our count, but what we have, the situation for us with Geiger Correction Facility, those are all part of our count. Is that correct?
Correct.
Okay, thank you.
Mm-hmm.
Other questions for Steve related to the data?
Just to confirm, you said 67 current outbreaks in long-term care facilities. Was that the number I heard?
67 total. There are 35 currently under active status. So they have not passed the 28 days with no new cases.
Okay.
I just have a quick question too, and I know we've talked about this. So why is the Airway Heights Correctional Facility outside of our county, or why would those numbers not be included in our overalls? I'm just curious.
So we count based on county of residence. So many of the individuals at Airway Heights Correctional Center are not Spokane County residents. That it takes a little work. It's why there's some editing. You guys will see the numbers move here and there. It's as we go through the EMRs and the lookups and do our data cleaning, we'll identify those who are Spokane County residents and those who are not, and assign them to the county of their residence.
Got it. That makes sense. Thank you.
But Steve, just to confirm, you said the current number does have some of the Airway Heights Correctional in there, but that number will be updated at a later date, and so it could tick down a few, correct?
It'll tick down a few. The initial big push where we had a really high jump, there was about 200, and that was all of them. We've cleaned that data up, so it's gone down a few, and we will assign any who are Spokane County residents to Spokane County, but it'll tick down a little bit as we continue to clean it up. We've done a pretty good job of catching up on that.
Thank you.
Okay, I'm not seeing any additional questions for Steve. So, Dr. Velasquez.
Good morning, everybody. I would like to update the group today on 3 different items. I see someone smiling because I usually do things in threes, but the 3 areas I would like the group to get an update. One is education, second one is testing, and third one is vaccines. So starting with education, since I joined, I've spent a fair amount of time with K through 12 as well as higher education. Actually, in some ways, a significant amount of time, which I think is important. Not only myself, but the epidemiology team that has a specific group assigned to education. And what we're trying to do is determine the safest and best way to bring students back as soon as we can within the parameters that we have of high numbers in the community. So a couple of things that I wanted to highlight. As an example, last week we had a meeting with about 52 representatives from school districts, private schools, parochial schools, and the goal is to do three things. One is determine where they are and how can we help them move forward within the parameters that I mentioned. Two, what would be the safest way to move to other grades beyond K through 2, which we've done traditionally, and the schools have done a really good job with that, and we've learned a lot. And then 3, try to gain a line of sight for what the future plans are. And although we can only predict a few weeks at a time, based on the movement of the virus, we would like to understand what the schools are trying to accomplish in the longer term for next year. Because the more we know, the better able we are to provide guidance and assistance in developing the plans to incorporate other grades and other classes. Because at the end of the day, one of our biggest concerns, one of my biggest concerns, is the mental, behavioral, and performance impact that not being in school has on children, and particularly younger learners. So we're trying to move those within the context of safety as soon as possible. So I wanted to share that with you because we spend many hours. A very important thing for us, a very important thing for the community. We also spend a high amount of time with higher education. And I tell you, higher education in some ways is a microcosm of the community, if you think about it. Some of the campus we have around, like, Whitworth, Gonzaga, they have a little bit of everything. They have people that commute in, they have people that reside there, they have retail, they have restaurants, they have gyms, they have all the components of a community. So we've been studying their testing models for students and staff, and that will help us on the next subject a little bit, which is testing. But I wanted to reassure all that we're very diligently working with education. Our goal is to make sure that as many students that wish to come back to school can, within the context of a safe environment. So that's topic number 1. Topic number 2 is testing. And as you heard Steve, our testing numbers, i.e. capacity, has gone up, which is actually great. And the reason why I say that is because to manage this pandemic going forward, the 3 pieces that need to work together. One is the public health measures that we talk about, facial coverings, etc. Second, vaccine, and third is testing. All of those 3 need to work together. It's the only way that you can actually control a pandemic. It's not just one of them. All 3 need to work. So one of my observations is we all agree that testing going forward needs to be more distributed and is very, very important. But at the same time, because we all agree is very important, I noticed that there was significant duplication in the community. And I can tell you, prior to my arrival here, I was part of at least 2 different, maybe 3 groups that were looking at how can we do more testing in the community. So in spending time with all of these groups individually, we have come to the realization that probably the best way to do it is to have a single unified community-wide testing work group / task force, which we are going to coordinate out of the district, and I will be happy to lead. So we're incorporating representation from all of those groups, which will A, eliminate the duplication, B, increase the efficiency, and C, ensure that we actually have full and wide representation from all members of the community. So our first meeting is actually this Thursday, and we're very excited about it. We have about 54 representatives from healthcare, independent providers, higher education, community groups, retail, etc. We were very careful to ensure that we have very broad representation from every single community group and every segment of the industry in Spokane, as well as higher education and others. So I'm sure that there will be some work that will need to be done with the group. Sorry, that's my phone. But the first step is to bring all together, make sure that we all agree on the strategy going forward. And the reason why I mention that is because we are going to have to move into an environment where testing is broadly performed, not only diagnostic testing, but also surveillance testing, which we're talking about rapid tests like the ones we're using in some of the outbreaks the district has been using for the last 2 or 3 weeks. And that is a way that we will be able to not only control, but also provide reassurance to the community as we look at reopening our economy in the future. So I wanted to share that with you because if nothing else, I think this will unify the voices as opposed to having multiple asks. We will have one big ask, and I want to underscore the ask because at some point we'll probably have to ask for support. It's going to be, we're going to need a lot of testing and resources. We do have commitment from a large number of volunteer groups, from students to community members that are willing to be trained and be helpful. But at the end of the day, we will need to get the kits, the supplies, ensure that we have the supply chain to go along with it, and et cetera. So we decided to coordinate out of the district. We don't do diagnostic testing. We do surveillance and outbreak testing for specific issues, but we can certainly coordinate the efforts on behalf of the community. So we took that to task and we're moving forward as of this Thursday. So that's the second update that I had for you. And then the third, we've all heard about vaccines. We saw the governor's press conference on Sunday. And I want to give you the highlights because as soon as there are numbers out there, things start to get confusing for all of us. So the highlight for us is we have 62,400 vaccines coming to Washington State by the end of the week, but as of Sunday, we only have 9,750 that have been received. About 3,000 of those have been allocated to Spokane. And I wanted to highlight that because I've already heard some conflicting numbers out there. So we're getting about a third of it, which makes perfect sense because we do have a significant number of the phase 1A providers that are at high risk, as well as the high-risk individuals in long-term care. So the reason why I mention that is to underscore the fact that the vaccine is going to be coming in more than one shipment. We do expect before the end of December to get another 220,000 approximately, which will be also equitably distributed. And we do expect to get another 183,800 of the Moderna vaccine, either later in December or early January. So if you add all of that, it probably doesn't cover all the 550,000 people that qualify on phase 1A. So we're going to have to be very diligent about doing that. Right now in Spokane, the district is not going to get a shipment of the Pfizer vaccine, which is the one that is being received. We will participate in the shipment of the Moderna vaccine. And one of our goals with that shipment is to help by setting up immunization clinics for EMTs, EMS, fire, and all of our first responders that qualify under phase 1A. So I think it's a step in the right direction. We do know that there's other vaccines. As I mentioned, I think probably the last time, Johnson & Johnson has a single-dose vaccine that is going in front of the FDA early in February. And by now, there's about 200 vaccines in preclinical and clinical trials around the world. About 137 are moving forward. So the reason why I bring that up is because our goal is to make sure that for every person that wants a vaccine between now and the summer, that we can get that. We're not going to get it on day one, so we have to be diligent about that. But at the end of the day, those of us that wants to be immunized, I'm one of those, although I don't qualify on the 1A because I don't have direct hands-on healthcare provision right now. But at the end of the day, we'll have the vaccine, we'll have the increased testing, we'll continue with our public health announcements and policies. And I know everybody's getting tired of hearing about the facial coverings, hand washing, et cetera, but that's usually step one on every every contagious disease. That's the first step. So with that, I'm going to stop here and see if anybody has any specific questions of me.
Go ahead, Katie.
Thank you. Our mayor had a question, Dr. Velasquez, he wanted to know is Spokane prioritizing first responders? I know I know enough about the categorization. He was just wondering, how are we prioritizing first responders?
You're on mute, Dr. Velasquez.
And I was saying something so eloquent. It's my apologies. So first responders are on the first phase, and actually we locally are prioritizing those with the Moderna vaccine that will be here in the next few weeks. And that's where that additional 183,800 for the state of Washington and the allotment we get. So we will be prioritizing that through the health district. The initial shipments are going to the providers, specifically more likely Multicare and Providence. And there's two components there. One is the hands-on staff, high-risk staff that is providing care, intensivists, et cetera. And if there is the possibility of immunizing others than their staff, that's being considered at least by Multicare at this point in time. But the number of vaccines is so small right now that we really, really have to focus on those that are hands-on with the high-risk patients right now, because it's the only way. And I know it's because I just met last week with emergency EMS and EMTs and so on and so forth, and I know they're hands-on, and I know they're high risk. But the highest risk right now is those providers that are taking care of the patients day in, day out, and through the night, and so on and so forth. So we're trying to prioritize within the prioritization based on category of work. Wonderful. Great question. Thank you.
I have one other question. With the 3 different vaccines that you mentioned, I'm sure eventually there may be more. Does the health district have an opinion on one vaccine over another, or are you just going to distribute them as they become available?
So let me paraphrase that a little bit. So we've been reviewing, and I've been reviewing the data coming out of all of the trials for the vaccines. And all I can comment on is on their efficacy and safety, which is the data that we have. I can tell you the first 3 seem to have fairly comparable efficacy data and fairly comparable safety data. So I personally will be amenable to getting any of the 3. And we're going to continue doing that. We don't have information because it's not available yet about the Johnson & Johnson, which is the one in February, but I'm sure that will be coming out going forward. One piece of information that we probably need to remember is that the state of Washington, in coalition with some of the Western states, has a standalone review committee for efficacy, safety of all of the vaccines, which met immediately after the FDA pronounced that the vaccine was acceptable for emergency use authorization, and reviewed all of that. So we have another safety check beyond other states, which gives us in the district a great amount of confidence because our health department is involved, and we do have an independent validation of all of the data. So that would be like 3 different steps, because the company does it, the FDA does it, and then we do it. Good question. Thank you.
Any other questions for Dr. Velasquez before we turn it over to Lindia? All right, Lindia, I think you're good.
Okay, good morning. So I just wanted to run through our incident command structure just for those that are on the line or in this meeting. We continue to use the incident command system to run this response. And then if you remember that the recovery committee really is our link with the city and the county to continue with coordination and communication. So I just wanted to reiterate that. So city and county are welcome to also, present and talk with us so that we can continue good communication. As part of the ICS General Command, we include public information who works within a joint information system, coordinating all the information in the county. We have an equity office that runs an equity task force. We have the safety officers who monitor our agency and staff for safety, as well as the isolation and quarantine facilities. An emergency response liaison who coordinates with other response agencies, and the Ready Healthcare Coalition who monitors healthcare capacity, the correction systems, and other elements of healthcare such as patient placement. ICS also includes 4 branches within our agency: operations, planning, logistics, and finance. So I just want to briefly talk about what's in each of those branches so that you really understand kind of what's going on within our agency. Operations contains a disease response branch, a community health branch, quality planning and assessment, and environmental public health. So within the disease response branch, it includes surveillance, case investigations and contact tracing, consultations, vaccine planning, testing, isolation and quarantine facilities. Our community health area covers care coordination, supporting our vulnerable and priority populations such as pregnant women and populations with higher cases, childcare, and food security. Quality planning and assessment covers our data collection and reporting, our call center, and medical surge monitoring. Environmental public health covers our business technical advisors and fatality management monitoring. So today you heard the health officer report on testing, vaccine, and education, which are kind of the 3 areas that are of greatest concern. And then I think Amelia will be reporting a little bit on our healthcare surge meetings that we've been holding. Our situational report will come out today. It comes out every Tuesday. And as always, if you see something in that report that you want more information on, just let us know. I think Kelly will be talking a little bit about communication. And I just wanted to highlight that Facebook Live this Wednesday is on the vaccine. So I know that there are a lot of questions about vaccine, and that's something that people can chime in on. And then one of the highlights that I wanted to give is that during the month of December, Spokane Mobility is joining with some community partners in Spokane County to pilot a new food delivery service to help overcome food shortages. It was funded by the CARES money, and the program will provide delivery of food boxes directly to households in need. So this was a pilot project that really stemmed right from our discussions in this group. So I just wanted to give a success story or a highlight. Any questions? Okay, thank you.
All right, there was a question in the chat, and Lindia actually set it up really well because I'm also going to talk a little bit about structure during open discussion, but we'll have Kelly talk right now about communications.
Hey, everyone, everybody can hear me okay? Let me see. All right. In general, the communications group, we've been communicating about the new quarantine guidance over the past week, updating our website, talking about that opportunity to reduce quarantine to the 10 days from the 14, and we sent out a press release about that. We're also keeping our eye on the DOH data. There's been some adjustments here and there. And we're just making sure that if we need to have communication around our data about that we're on top of it. A message of thanks, PSA, that's begun running this week. I think that a lot of your agencies have been sharing that out, and you had representatives on there. It's also been incorporated into our digital ad buy, and I've been receiving good comments about that. So I think it's a good time of year for that message to come out and see our frontline and first responders letting the community know that they appreciate their hard work and following the measures and helping to slow the spread. Our young adult campaign has been incorporated into some of our billboards that we have with Lamar and with Emerald. And we've added, again, that PSA to the digital media buy. Unfortunately, with everything happening at Gonzaga with athletics, we were not able to do our PSAs that we planned. We're still in conversations with them, and we can still do those when they get to a spot where they feel good about the health of their student athletes and move forward with those. It would just be after our buy, which has to end on December 30th. On the vaccine, been in constant communication with DOH, with their communication group, and following their plan. They are currently working on employer guidance regarding expectations, especially with some of the side effects that come from the vaccine. So just getting communication out there, prepared to be out there. We sent a press release out as a response to the governor's announcement that the vaccine was approved and will be sent to Washington locations this week. We also talked about the press conference and shared that on our social media platforms. There's also a DOH public webinar called Making Sense of Vaccines During COVID-19, and that's actually today from 5 to 6 p.m. That's open to the public, and we're sharing that on our social program. And there's even a Spanish version that is being ran on the 17th. So check that out or share that if you have people that are asking questions about the vaccine. As Lindia mentioned, our Facebook Live is going to be about vaccines as well this week. So the lead of our task force, Kayla Myers, will be presenting. And we've also been set up meetings with school communicators. So we are talking to them about the messaging that they feel is most important or some of their priorities. A lot of those were the health measures, reminding families of following the health measures or their gatherings when they're at home. And then also a reminder, keeping kids home when they are sick. And a strong need for mental wellness resources and tips. And even for their staff, like internally, signage or messaging to help remind them that when they're in the staff areas or the break areas to watch how close they are, or put their mask back on, that's not the place where they should be taking a break from their masks. So we're putting together some like messaging kits that they can easily turn around. So social media messages, short snippets for newsletters, again, signage. So we're working on that right now with them. Also working with our hospital communicators just to make sure we're in sync when it comes to the vaccine, and also supporting them for any messaging they want to get out when it comes to surge capacity or how they feel of their confidence level and how the hospitals are doing. And then with our media relations, there's been a lot of interest, of course, in the correctional facilities. We participated in a press conference with the county last Friday, and which I think went over really well in explaining our part that we play as the health district and working with the county. And just more questions about masking and the COVID vaccines, of course, the announcements, the planning, the administration, some questions about anti-vaxxers and how that strategy is to communicate when we have a strong group of that sentiment in our community. And that's overall. Is there any questions?
Hey, Kelly,
Yes.
Will part of the education be the importance of continuing to wear masks even though you've been vaccinated, that it's not just a free-for-all once you get the vaccine, that you can still actually infect other people?
Yeah, on everything that we've been writing, from updating our Q&As to Dr. Velasquez actually has an op-ed that's going to come out on Wednesday. There's a reminder in almost everything that says this doesn't mean you have to stop following precautions. You still need to be watching your gatherings. You still need to be wearing your masks and washing your hands, and all of those items are still very important.
Other questions for Kelly? Okay, thanks, Kelly. Looks like GSI, Alicia or Kara?
Good morning. Nice to see everybody. Excellent information this morning. Just a couple of updates. I'm actually just want to share a little bit, picking up on Lydia's comment on some success stories. I was just on the United Way board meeting this morning, and they were just discussing, they just received a bar and restaurant worker grant that they're working specifically with Big Table, AHANA, the Hispanic Business Professional Association, the Pacific Islanders Association, to distribute some dollars directly to some of the these workers that have been most impacted as a result of the closures within the hospitality sector. And so it's not a huge grant, I think around $40,000 to $50,000, but they're looking at distributing some small grants through these associations to some of the workers and their families. So just in this extremely challenging time of need for them, that's a great thing to share this morning. And then at a broader level, we're in the final kind of throes of the distribution of the funds for the Spokane County Hospitality Grant Program. And so continue to push towards that. That also has a December deadline since it's all CARES dollars. So we'll have final numbers and things probably either on the call next week or the one following as we work on that final distribution. But a huge, overwhelming amount of need in response to that grant program. So a thank you to the county on that. And then also the distribution and process is beginning on the $100 million from the Working Washington 3.0 grant that is being distributed through the Department of Commerce. You probably all saw, but there did the amount of funds in that program last week. And they've had over 20,000 applications statewide to that fund. And we haven't gotten localized numbers yet, but will. So we'll expect to see some additional dollars here. That's also currently on the December deadline as well. So we'll see hopefully an infusion of support for those employers most impacted at this current time. And then the last couple of things I would just say is that we're a lot of work going on with our state partners, like all of you, really interested in what's going to happen at the federal level on the policy perspective of the COVID relief package, certainly for aid to the state and local communities, and also around employer liability impacts, especially as we start to see some of these other things start to roll out with vaccines. And then in a handful of conversations at the state level around the unemployment trust fund impacts. And so those two things are top of mind for employers here at the end of the year as well. And then lastly, on a good news, Kara just texted me, but we're also in the process of wrapping up the Spread Kindness consumer confidence campaign. We'd be able to share some great data with everybody here right after the end of the year. But the final ad that'll be primarily on social media will be out later today. And so look for that information from Kara. And that one's really focused on the power of we and helping to build some confidence collectively as we move into the first of the year and in this challenging time. So happy to answer more specific questions, but those are the things, some of the big things in front of us right now.
Thanks, Alicia. Questions for GSI? All right, thank you. I am now going to turn things over to Heather Wallace. Like I mentioned, Heather is helping with our equity branch here at the Health District related to the response. And it's really one of the unique things that I think Spokane is doing in our response to really make sure that we are getting needs met in all communities. So Heather, oh, there you are, and you have the floor.
Thank you. Good morning, everyone. I'm going to be sharing my screen. So as I'm clicking a whole bunch of buttons to get that up, I just wanted to let you know I work in the operations section and the sorry, I found doing two things at once is quite challenging under COVID. I'm the deputy branch lead for the community health group. And today I'm going to be talking a little bit about housing and what we're seeing in the community care branch and kind of community at large. And so we're going to see if this works. So I have a short presentation that I'm going to talk about. And so in the community care branch, we have three goals. One is to make sure that folks are able to isolate and quarantine safely. The second is really to make sure that we're preventing community spread. And third is that we have equitable access to resources for highly impacted populations, those that have concerns about accessing resources, testing, and then are really impacted by being asked to stay home during if they have a personal infection within the household. And so I'm going to talk a little bit about a need that comes up really frequently and is pretty much in crisis state at this point, and that is housing. So a little bit of background information. In the city of Spokane, there are about 42,000 rental units, and there are assessed to be approximately about the same amount out in the county as well. Within the city, 7,200 are considered low-income units, and about 39,000 are in the low, middle, and upper income rentals, what's typically called market rate. Prior to COVID-19, 55% of tenants spent more than 30% of their income on rent. So you can imagine with COVID hitting that the financial impact is pretty significant. So by the end of July, 15 to 18% of low-income renters were already behind on their rent, and between 1 and 1.5 of market rate tenants. That was approximately 1,400 to 1,800 renters in the city of Spokane. This information is coming from a couple of sources. It's coming from the Landlord Association as well as the Tenants Union. And then some of the information is coming through our conversations and data that we are gathering as we are providing community care services. So as of December, there is between 2.5 and 3 million in owed back rent just within the city limits. And they're estimating that that's increasing by about $2 million per month. So far in our response, just under 30% of our clients have expressed needing financial help for rent and utilities. There was funding that was available that was being administered by SNAP and a couple of other resources, and that has actually completely been depleted. As of about the 1st of December, there are currently no remaining rental assistance funds. And just since that time, we've had 40 families who have requested rental assistance that we've basically had to say, we're sorry, but there just isn't a resource. And the response that we're getting is that clients are saying if they cannot pay their rent, they are concerned that they're going to be homeless. And so we're having a really hard time reminding people of the importance of staying home. And folks are saying that they're just going to have to go back to work because they can't afford not to pay their rent. With the looming end of the eviction moratorium. So this has multiple impacts. So the financial crisis, with folks either workplaces being closed due to the governor's restrictions, or folks needing to stay home for isolation and quarantine, means that families are just not bringing in the resources that they have. Traditionally, folks are turning to payday loans, use of credit cards, borrowing money from families, but those resources are really also very tenuous and put families kind of on this treadmill of always having to catch up. Additionally, it's having an upstream impact on landlords who are needing to pay mortgages and have just found that they can't carry tenants for months on end. Excuse me. And so there's reports of landlords selling homes, which often then leave the rental market. They are either, being occupied by the owner, or a lot of homes are going into Airbnb type status. And this has a really harmful long-term impact, not just on finances, but on the stress and mental health of families. Can lead to increase in child abuse and domestic violence. And of course, that stress does bleed down onto children. And as Dr. Velasquez talked about earlier, it impacts, the entire effect of the pandemic, including financial stress in a household, is having impact on children's mental health and academic achievement. Additionally, and sometimes most concerning to our own team internally is that as we see folks being displaced, that increases the burden on the homeless system. It increases the individual's susceptibility because that stress level increases susceptibility to disease across the board. If we have folks that are displaced and not traditionally being able to isolate at home, it also increases disease spread. And all of this puts pressure along the response system, testing, case investigation, isolation, and care coordination. It puts increased pressure on all of those things. Oops. I'm not sure why. There we go. So looking at kind of the totals from a dollar perspective, as I said, all of the rental assistance funds have been depleted. And in order to prevent massive displacement after the eviction moratorium, kind of financial collapse of thousands of households, and a significant increase in disease spread, the current financial need to carry through April of 2021 is estimated about $6 million in back owed rent across the county, with an increase of $2 to $4 million per month, which then equates to approximately $22 million for households. This would be back rent, and then the estimated through April, when it's most likely the moratorium is set to end at the end of December. There is confidence on the landlords and renters side that that's probably going to be extended one more time, which would carry us probably through April, but that's all based on kind of some assumptions. So as you can see, this is one of those additional pandemics. We have the disease pandemic, we have mental health pandemic crisis, and financial, and essentially what financial ends up really looking like is people being uncertain in their housing with the potential of eviction, and then that adding to the disease side as well. So that's everything I have on this particular issue that we're looking at. And if there's any questions, I'm happy to do my best to answer. I'm not the expert. I'm really brought some information together, but I'm happy to answer questions, and if need be, look up information if I'm not privy to it currently.
Thank you, Heather. Yeah, and I want to make sure we will send out Heather's slides with the notes for this week, because I know this group likes the data and the numbers, right, to be able to use for talking points. That was really great information, Heather. Any questions? Oh, Commissioner Cooney, go ahead.
Yeah, so Heather, so what agencies are you getting the data from and the information, because like with Spokane County, we did ours through SNAP and we hadn't got a report back from SNAP that they had exhausted all their rental assistance. We're kind of hearing that through other people. So I'm just curious, because I know, other agencies got rental assistance funding too. And so, so I just don't know who all those agencies were.
Yes, so we directed folks to SNAP, to the Resource Center, and then there were some agencies that had little small pockets of money. There may be a very, very small specific criteria, and just feedback from them that those have been exhausted. We work with SNAP pretty consistently. They have been a great help with a lot of different issues. And just after the first, we were notified that their rental assistance funds were depleted. And what's really unfortunate is some folks, and I don't know the number on this, I can certainly gather that, folks were on the wait list, and before their number sort of came up, the funds were depleted. And so they were kind of under this assumption that they were on a waiting list. They put in their application and the relief was going to be coming. But before they could be reached, the funds were actually depleted. And so we've also had, although we've had 40 just in the last week and a half, there are likely hundreds, potentially thousands. I dare speak that high, but who we had served, we connected with SNAP, they'd filled out their application, made it on the list, but then they will not receive funds because those are all gone. And I can get, Commissioner Cooney, I can get the specific date and the number of applications outstanding, and I can send that on.
Okay, thank you. And then I was thinking like workforce had actually gotten some funding too through our CDBG entity. So again, I may talk about this more later, or maybe I'll just talk about it now. It's like, I just feel like we haven't done a great job. I would say us as electeds haven't done a great job, knowing where all those funds are going and all the different agencies so that we can make sure that all that data is collected. And so that's actually going to be my request to the group today is as we look at our funds, because, our funds are done, the cities had already had to spend theirs. We need to have ours spent by the December 30th. So it's, figuring out a way that we collect all that data as to where all of our CARES funding went to, what agencies, what did it help go to, from the county to the city of Spokane, to the city of Spokane Valley, to all our smaller cities, Liberty Lake, Millwood, Fairfield, Rockford, they all got CARES dollars to see where did those funds go and how did we help in our communities. So that way, as we look forward to, if we hope that there may be a next package from the federal government, what is providing that the best use of those dollars, and what can we kind of learn from what we did to know what to do in the future if we get that. If we don't get it, then at least we know what we did and where we spent those dollars, as a community, not just as each entity. And also look at, because I know in Novia, there was private philanthropy, donations that went out as well, to just see what happened in Spokane County, again, from a holistic perspective, from those funds to see where those dollars really went. I think that would be really key. And so I don't know, Jerry, if we, you and I talk to try to figure out, who we have kind of coordinate that. But I just think that would be really good for the community to understand and know, as we come to the end here, and then, look to move forward into next year.
I think that's a really good idea that, you can't, it's really hard for us, or for you elected especially, to know where you're going to go if you don't know where you've been. And I think with all the money and how it was distributed and everybody's, trying to do the best they can, it's difficult. It's difficult to make good decisions if you don't know exactly where all the money went. So we need to figure out how to get that information, put together, and then how to distribute it.
I guess my ask is to the other cities and entities that are on this call, that probably we'll be figuring out who's going to be coordinating this, but, the call's going to be coming, but we try to, put this information together. So thank you.
Do we want to, oh, I'm sorry, Alicia, go ahead.
No, I was just going to and I mentioned this to Commissioner CUNY yesterday, and I am waiting for a response, but some of the earlier work of the recovery task force back, midsummer, we were starting to collect some of that stuff on a spreadsheet between a handful of folks. And so I have an ask out to see if they've been maintaining that, or if we could at least use that as a starting point. And they've been collecting data from all of the different cities and entities involved. So I'll loop back around with you as soon as I hear back from them.
So Jerry and Commissioner CUNY, do you want me to make this an agenda topic for next week so we can maybe think through details? I'm seeing a yes. Okay.
Yeah, I think we'll see what we can try to put together between now and then, and I'll talk with Alicia and kind of see where we're at and see where we, what we can get to. I know at the county, we definitely have our list. So I don't think it's going to be that hard from the municipalities' perspective. It may be a little harder on the philanthropy side, and it may not be. I don't know, but yeah, let's add as a topic, and then Jerry and I can see what we can put together with the help of Alicia. Thank you.
Perfect. All right. Any additional questions before I move into open discussion and talk a little bit about readiness planning?
Yeah, Amelia, I had a question. This is Josh. I had a question for Heather. Heather, on your presentation, you had a percentage there on one of the early slides of sort of current delinquents on rent. Did it say 12 to 13? Was that about where it was?
Current in dollar amount?
Well, it was percentage of late. I thought it was individuals who were late on rent.
Okay,
it was a percentage of renters. What was that? How it was presented?
Yes, this was the end of July, and so that was 15 to 18% of low-income renters, and 1 to 1.5% of market renters. And so at that time, it was estimated, it's not a firm, so it was between 1,400 and 1,800 renters as of July.
So do you have any data to compare that to as to what the average, what does that number look like in a non-COVID world? I mean, you have it in July where we were in the middle of the pandemic. You have it today where we're even further in the pandemic. But what would any idea what those numbers were back in, say, January or July of last year? Comparing, I mean, is that number at 12 and 13%? Is that, is that double what it normally is? I mean, is that number normally at 0, which I wouldn't think it probably is, but I mean, there's always a number of folks that are late on their rent regardless of a pandemic. Do you know kind of what's sort of that equilibrium point so we can kind of compare how much of a jump this is compared to where, how much was caused by COVID and how much would have been there regardless?
Gotcha. No, that's a great question. I will reach out to the president of the Landlords Association. He provided me with that data on late rent, and I will get that to you along with the other questions.
Okay, thank you.
Other questions? All right. Thank you, Heather. So for open discussion, I wanted to kind of follow up with everyone on readiness planning. The health district, as a lot of you participated in, we completed an initial after action review for the first 6 months of the response to COVID. And so that executive summary will be coming out to a lot of you as community partners just to get that in front of you so that you can see the areas that we will be working on to improve. And one of the issues that was really kind of obvious that came up to the top of the after action review was really a need for a better understanding of response structure and how that works within a pandemic and within a public health response. And so, for those of you who spent time out at the EOC, we kind of always had this recurring conversation about, what are the different pivot points? Because unlike a wildfire or an ice storm, where you kind of like respond, fight, finish, recover, a public health response can take a long time, right? And so that's what we're in right now. It's been almost a year, right? So January 21st, I think we had our first case come into the state of Washington. So we have put together, and Anna's going to share my screen or share her screen, just to kind of, so I can educate everyone and review, and this will be included in the notes of kind of where we are in the response and what it looks like. And, one of the reasons I wanted to bring it to this group is that because we're in a region, it is just really critical that we all stay connected and respect the structure of the response, because if we don't, we can really get wires crossed, and then we start kind of working on top of each other and not complementing each other's skills. So, the first area is kind of monitoring. That goes into, what we were kind of doing over the summer with our lower numbers. We were including a lot of things within normal staffing duties and then reporting out to this group. The next area, which is where we are right now, is really our readiness area. So, I am in contact, staff are in contact with municipal and county operations departments. We are doing our normal program duties. We still have a significant number of staff that are working on response duties. And then, of course, we're also keeping all of you informed as community partners and as the recovery group. So, and I think this is probably where, we've been getting a lot of questions because of the rise in numbers. If we would need to take it a step further and activate us into anything, that is actually a conversation with the sheriff for activating the Emergency Coordination Center and kind of formalizing our local incident command structure, which we are already operating in here at the health district. And then, obviously that kind of far bright red area, that would be if we were kind of in full, like what New York was experiencing earlier in the summer with, needing to reassign people from the health district, from the municipalities, non-governmental organizations, and any other stakeholders. And Linda talked about this, and we're going to include it in the notes, but can you scroll down, please, Anne? Putting this kind of into, if you're familiar with Lean or Six Sigma, like a swim lane structure of seeing kind of how incident command would feed this group. And can you scroll down? There we go. I'm kind of there in the middle with the incident commander reporting to me, because I'm the head of the public health agency. And then Dr. Velasquez and I would be tied very closely together in making sure we stay coordinated and giving the same information. And then for briefings and advisory input, that would still be this group that we would bring information to. And then, ultimately the health district reports up to the Board of Health, which some of you are on, or some of your representatives on from your agencies. And so I will update this to include the different areas that Lindia mentioned under work plans and deliverables to include all of our different sections. But just wanted to make sure we were all on the same page related to the response structure, because the important part of this is communication. That's the whole importance of response, is that we have really strong communication lines. So this will go out to everyone, but if anyone has questions, I can answer those. Okay. I
think that's a really good start. I personally like this. It flows better. It makes it's less confusing than our first attempt at this. At least for me. Mm-hmm. So thanks for your work on this.
Yeah, no, and I think it really, it kind of, I think, helps get to some of those things that we saw come up in the after action review of people not kind of knowing how it all worked together. Other questions? All right, well, we will include this in the notes that go out. So if you have updates or things that we need to change or something that we missed, please bring that our way. On our schedule right now, I have us meeting on the 22nd, but I'm already seeing that there are going to be a lot of people who are unavailable on the 29th for maybe, being out of the office because of the holidays. So I would recommend that we cancel that meeting, but it's kind of up to the group. Thoughts on that? Okay.
Cancel which one? The 22nd or the 29th?
The 29th. I'm not seeing anything, but I have to tell you, this is my new favorite Christmas gift. I always say to our managers, like when I ask questions and don't hear anything, hopefully you can hear this. I now have a cricket sound effect that I can play for those moments of silence. So
Amelia, my recommendation would be to continue with the 22nd. And I would say tentatively cancel the 29th unless there is some significant thing that's hitting the news regarding COVID in this region. I think if something significant is hitting the news in this region, that the decision makers that are part of this call will want to know, be better informed about the backstory.
Yeah, I was gonna say something similar because the health district, we'll be monitoring the information throughout the holiday.
And I would think that if we do
you can still send out the report.
I was gonna say, I think if we do something on the 29th, it doesn't need a long agenda. It would be simply for the purpose of a data update.
We could do that.
Thinking, Amelia, that maybe you could just still send out the numbers, the data report.
Okay.
And that way, we have that. We can take a look at it if we don't need to meet.
We could do that. Anyone else? All right. Well, we will get all of this information out to all the notes, just like we do every week, and we'll include Heather's slides in there for any questions you have about her presentation that she made today. And I think we're done. All right. Thanks, everyone.